Hello, welcome to my vlog. This is going to be a weight loss surgery vlog specifically on gastric bypass, as that is the surgery that I am pursuing myself. So any information you get from this blog, I'm not a medical professional, so it's best to consult with your own doctor. But anything that I tell you is going to be from my instance with my program and geared towards the gastric bypass surgery. So with that said, I am not a medical professional. Don't take my advice as set in cold stone. It's just my experience. My name is Jennifer. I'm a 30-year-old. I am a single mother. I'm not going to tell you my weight right now. I'm not comfortable with that, but I am fairly obese. I'm on the larger side of the recommended BMIs. So I am looking at gastric bypass surgery. I had my first appointment with my primary care physician yesterday. And she was all for it. She agreed that this would be a good option for me. She was impressed that I knew so much about it, that I went in. I have a 3-ring binder that I have all of my research and everything printed out and put in it, and I've written in it, and I have notes and questions written down, and so that really impressed my doctor. So my insurance, I have a checklist from the surgeon that I want to go to. I have a checklist from him. Sorry, my dog's here. She wants to be in the video. This is Akira, by the way. She's a Great Dane. Anyways, back to me. I have a checklist that my surgeon that I want to go through has the different requirements for most of the insurance policies and companies that are around our area. So I went through the checklist for my insurance, and they require a 6-month medicated, doctor-supervised diet prior to the surgery. So I was hoping that my doctor would fill out one of the pages. I have all 6 pages of the form printed out and ready, and I was hoping my doctor would fill one out for me, but she does not want to do my diet herself. She wants to refer me to what they call the health coach, which is a nurse within the practice that they send patients to learn about diets and just different topics in being healthy, I guess. So I'm nervous that that's not going to be enough to satisfy the insurance company. I think it has to be a doctor or a dietitian. So I'm going to call the insurance company on Monday and see what they say. The doctor has also written a referral to the surgeon. Like I said, I'm going through Dr. Matthew Glascock in Cedar Falls at Sartori Hospital. I've gone through this process once before. I have not had gastric bypass surgery yet, obviously, but I went through the medicated diet with a doctor, I'd say 3 or 4 years ago. I had come down with the flu, and so I was really sick, and this was month 4 of 6. I had the flu, and I went to my doctor's appointment to talk about my diet, and the doctor asked me what foods I had been eating and how I was doing, and I made the stupid mistake of making the comment to him. I said, I have only been eating what I can keep down. Well, despite losing 10 pounds that month, he circled that I was non-compliant with the diet. And that started me back at step 1. I was devastated. So I gave up. I didn't think about surgery again until recently. It's been a couple months. A friend of mine had the surgery over in Germany, and I've been seeing on Facebook all the progress she's making, and Yeah, I'm looking at the scale that's gone up 60 pounds since I last contemplated having surgery, and I've got to make a change. So I know that gastric bypass and any weight loss surgery, it's not a magic pill. It's not something that instantly fixes you. It does take a lot of work, and it's a lifestyle change. Um, you have to be fully committed to changing your lifestyle and putting in the work. Because as my doctor says, you can abuse the tool, you can misuse it, and you'll still be in trouble. So this is a lifestyle change, and I'm ready to make it. So here we go, step 1. I went and saw my doctor. Now I just wait for the health coach nurse to call and set up an appointment with me, and I have to go and see a seminar with my surgeon, which I've seen one of them before. It's not really a big deal. The surgeon's office is about an hour away from me, so that's also not that big of a deal. I'm not going to get it any closer to me. There's just no major cities, and my small town hospital certainly doesn't do this surgery. So I'm excited. I'm ready to go. The one change that I have made so far since making this decision, well, I mean, yeah, I'm watching more carefully what I'm eating and everything, but the one thing that I have definitely changed recently is I have cut out all soda. I used to have a major Diet Mountain Dew addiction and regular Pepsi. I drink more Diet Mountain Dew than Pepsi, but still, neither are good for you. So that's my change that I've made, and I'm just hoping I can stick with it. I drink a lot of water, a lot of Crystal Light. I mean, I stock up on it. It goes on sale, and I'm clearing the shelf. I have tons and tons and tons in my cupboards. And I'm also trying to be a little bit more active. I can't quite do a whole lot right now. So, like, I do things like I'm a college student, and when I go to school, I park in the back of the lot and walk to my class. So, I do things like that, and take an extra lap around the store when I go to the store. Just simple changes. Sorry, there was a little bug in my face. Simple little changes. And hopefully they'll get bigger and bigger changes, and I can do more and more exercise as the weight comes off. So I will keep you guys updated when I have more to share. Thank you for watching.